Follow the money is a phrase that became popular following the 1976 film All the President's Men. Today I want to follow the money in healthcare to help us understand how Medicare and baby boomers impact your employer-based health insurance cost. Before doing so, it's important to understand a few dynamics in our country. First, consider the demographic shift involved with the baby boom generation. When Medicare was first started in 1966, the United States had 19 million citizens over the age of 65. By the year 2020, that number had grown by over 300% to 62 million. In this birth rate chart, you'll see we've noted the point where the wave is turning 65 today. Unfortunately, the current structure and trajectory will lead to an exhaustion of the Medicare Trust Fund by 2025. Now, certainly the issue of Medicare solvency matters a great deal, but remember, we still need to follow the money to fully understand how all Americans are impacted, including those under the age of 65. And that brings us to consider what reimbursement rate hospitals and doctors receive from employer-based insurance compared to Medicare. On average, employer reimbursement rates to hospitals and physicians are 241% higher than Medicare. Or for every $1 spent on Medicare for the exact same service, $2.41 is charged to the employer-based health insurance plan. This makes your insurance premiums higher because effectively the employer-based health insurance plans are subsidizing the inadequate and government-controlled reimbursement rates of Medicare and Medicaid and TRICARE. Follow the money, it's a hidden tax. More specifically, hospital systems have shared these numbers with us to help us follow the money. For every patient with Medicare in this hospital system, the hospital lost almost $400 per patient. Yet that same hospital system made approximately $1,200 in profit from those patients who had private insurance. Follow the money indeed. And this brings me to my final point for today. When politicians from both parties talk about either a Medicare option, single payer, or protecting the private insurance market, always consider this question: at what reimbursement rate? Because if a Medicare option is priced at the current inadequate Medicare reimbursement rates, hospitals will go out of business, especially those in rural areas. And on the other hand, if private insurance is protected, whereby it continues to subsidize Medicare, the employer premiums required to prop up Medicare will be under even more pressure because of the demographic shifts that we talked earlier with regards to the baby boom population. And that's the point for today. As we follow the money in healthcare, let's make sure we're having an honest discussion around who is paying for what, and let's make sure the root issues behind the shell game within healthcare finance are brought into the open. Thanks for listening, and thanks for following the money.